Doctors in the UK are set to stage the biggest walkout in the history of the state-funded National Health Service. Well, this comes against the backdrop of the UK's crippling cost of living crisis, which has prompted industrial walkouts across various sectors. Now, according to a junior doctors committee, medics have had a 26% cut in their salaries in the last 15 years, and soaring inflation is making the situation worse. Junior doctors are demanding a pay hike of about 35%. Now, the government has offered to increase salaries by a mere 5%. The UK government claims backdating their pay to reflect inflation since 2008 is too costly, as the government is battling high inflation. Well, according to the British Medical Association, a similar stoppages in April and June had caused massive disruption. Reports suggest around 600,000 hospital appointments have been rescheduled or cancelled due to strikes in recent months. In April this year, there were more than 18 million patients whose treatment had been delayed. Some 3 million have been waiting more than 18 months. Junior doctors in England make up almost half of all doctors. Around 86% of some 46,000 junior doctors of the British Medical Association have backed the latest walkout. Our correspondent Alex Isaac is joining us now for the details. So another walkout. We know so far there's been plenty of support from the British public. Do you think this will sustain?
Well, I'm outside here at the University College of London near Euston, and as you can see, well, if you can, when the buses go by, there isn't that many of the junior doctors protesting today, but there have been a few supporters that have walked by and have been shouting that they should be getting more pay. So those that have gone by and said that they are with the junior doctors have been quite common, and it's only early in the morning, but generally I think the polls do suggest that when it comes to NHS staff, whether it's nurses, ambulance workers or junior doctors, that many people are really behind them getting that extra pay rise. However, there is a slight differentiation between the junior doctors and the other NHS staff workers. Today, later, we are supposedly hearing from Prime Minister Rishi Sunak around 10:30 a.m. local time to decide whether or not the NHS staff and other public sectors will be getting that 6% pay rise that was suggested through the public inquiry. But of course that does not include these junior doctors at all. So the BMA, the union, is also fighting for a bigger pay rise for junior doctors. They have to deal with an awful lot within their role, and they want to not just get that extra money, but they also want to change their zero contract hours that they say they're being forced to use, and also the fact that when they are training they have to go all around the UK so that they can be away from friends and family, not for just months but potentially up to a year or so. So those are things that they really want to be changing and fighting for. But this is day one of 5 days of walkouts. But the BMA have said that they will make sure that all they can cover as much as they can, and that if there are any concerns within the hospitals that the junior doctors have walked out, that they will take the junior doctors off the picket line and back into work as well. But from what I understand, there are a number of junior doctors who have taken this opportunity to actually use this as their holiday break. So instead of being out on the picket line, that they are taking their paid holiday to get out of the hospital so that they don't have to go back and they don't have to be taken off the picket line. So they are trying to support their colleagues in a different way. But generally, I do think that the UK public is behind, especially when it comes to the NHS, these particular strikes.
Alex Isaac, correspondent in London for us. Thank you so very much indeed, bringing us up to date on the latest doctors' strike that on the picket line.